Namaste everyone. Today I am going to explain you about a new spinal disorder that is called as scoliosis. This scoliosis is a type of spinal disorder where your spine moves to one side of your lateral side of your body. That means generally your spine should be in a straight position, but the people having with scoliosis problem, there may be a thoracic mid back will be moving to one side, or the lower back, the lumbar part will be, the spine of the lower back will be moving to the other side. So the spine will be moving in this way. Okay, so this is called scoliosis. This scoliosis generally occur due to non-development of the brain or due to weakness in the muscles. This scoliosis also can be seen in the children, but the reasons for this are unknown. Still, a lot of researchers are being held why this scoliosis occur in children. Symptoms for this scoliosis will be uneven shoulders. The shoulders will be uneven like this. One side of the shoulder will raise up and other side will be little down. And spine also, if you see the spine, okay, the spine movement also will be like this. It will be one side of the spine will be twisting like this. You see from the back side. Okay, so one side of the spine will be also moving aside, and there is also many chances that due to this spinal disorder, your lungs gets depressed. Like your spine compresses the lungs, so it will also develop a problem with the breathing. Now causes for this scoliosis is, for many people it may be a birth defect, like people born with so by birth they will be having this scoliosis problem. And also people, if anyone have surgeries around the chest region, they also may have this kind of scoliosis issue. And people having uneven shoulders or uneven back related problems, spine related problems like lower back or upper back or shoulder problems, they also will have this kind of development of this scoliosis problem. So complications. So people who are having this scoliosis problem will be having a lot of complications during their life. So one is, the major complication is they breathe. As the scoliosis, the spine compresses the lungs, so it will be very difficult for them to breathe in, breathe out throughout the life. Secondly, they will be having pain in the lower back, knees and throughout the spinal region. And many people will feel stiffness in the shoulder region as well as in the joints region throughout the body. It is very difficult to cure scoliosis completely, but by following certain practices through yoga therapy, we can definitely make the life better for the people who are having problem with scoliosis. Now let us see what are the practices to be given for the persons suffering with scoliosis. So yoga therapy has given enormous results for people with scoliosis. All they have to do is they have to practice continuously over a period of time. So scoliosis, a spinal disorder, as I said earlier, it will be different for each and every person. So you have to, before giving yoga therapy, you have to diagnose the severity of the scoliosis. For some people it will be acute stage, and for some people it will be in chronic stage. Before moving to the yoga therapy or suggesting yoga therapy, I request everyone to suggest to consult a doctor, and then you suggest with yoga therapy. So it is just a practice which can be given for scoliosis, but before doing these practices, I request everyone to consult a doctor and do these practices. So first practice is, all you have to do is, this is a yoga block. You have to take a yoga block. Okay, put this yoga block against the wall like this. Okay, so then you have to touch your rib cage. Okay, the lateral side of your spine should be touched. Lateral side of your rib cage should touch the block like this. Raise your one hand like this. Put your hand on the wall. Okay, now little gap between your legs is must, and slowly raise your other hand up and stretch. And slowly come back. Again stretch. Slowly come back. Okay. So for beginners like people suffering with scoliosis, it will be very difficult for them to raise their hand because they cannot raise their hand completely. Okay. So it is necessary to take the assistance of the therapist who are making you to practice this. Okay, so this is one. Now second one, you have to place your hand like this against the block. Okay, you have to place your hand against the wall, then slowly stretch. Okay, similarly you have to do it on the opposite side. Okay, so this is practice number 1. So practice number 2 is you have to take a pillow. If you don't have a bolster, this is called yoga bolster. If you don't have a yoga bolster, you can take a pillow and place it on the mat. Okay. Now you have to lie down on the block. See, make the person lie down on the bolster completely. Keep your legs straight and okay. Now stretch your hands up and completely stretch your spine. Okay, like this. So you have to stretch your legs downwards and stretch your hands upwards. So you have to pull your spine on either sides of your body. So in this way, you have to do for at least 1 minute to 2 minutes in that posture. Okay, this is second practice. Now let us take the third practice. This third practice, you have to take a yoga rope like this and put it to the window. Okay, hold the both ends of the rope with both the hands. Okay, make the person stand. Okay, now bend your knees a little. Now stretch your pelvic backside and stretch your hands forward like this. And again come back. Okay. Make the person bend his knees. Okay, take 2 to 3 feet gap between the legs and stretch your hands straight. So you have to focus on lengthening your spine. You can look straight or you can look down. Okay, this is one of the best practice for scoliosis problem. Next, fourth one. So fourth practice is you have to use a foam roller. Okay, you should have this foam roller in order to practice the fourth one. So how do we practice using foam roller? Let us see now. So place the roller on the mat like this. Okay, now lie down on the lateral side of your body. Okay, like this. Okay, now slowly what you have to do, raise your body up and stretch your hands like this. Again come back. Again stretch. Again come back. One more time stretch. Again come back. Okay. So while doing this, you can see the roller will be rolling up and down like this. Okay. You have to carefully observe while doing this practice. The roller should roll up and down while doing this. Okay. Place it on the rib cage, not below the rib cage. Okay, on the side of the rib cage. Now slowly lengthen your hands and spine. Yes. Similarly, on the opposite side you have to do. Okay. These are the 4 practices which can be given for the scoliosis issue, even in the beginning stage or acute stages. But in severe cases, I request everyone to consult a doctor and then follow these practices. Okay. So if you are having a children around you having the scoliosis issue, you can suggest them these practices in order to lengthen the spine, and it also helps them their development of the spine. Okay, it also gives flexibility to overall body while doing these practices. Okay, I hope you like this video. Kindly subscribe to my channel and thank you. Namaste.